Michael's father was Attorney General of Massachusetts, and he's 95 years old now. So he has a leniency. His mother's 93, so for seniors. But he has a lot of programs for teenagers. There's a camp at Braintree where the kids climb telephone poles and swing from cables pole to pole, and when the first day they come to the camp, they can't step up 3 steps on a step ladder, and by Friday, 5 days, they're swinging on cables with belts, jumping all over the place, almost like a parachute. So he does this so the kids will get complacent, confidence, keep them out of trouble, keep them out of drugs. And it's a very important, we stress these things for seniors, we stress these programs for teenagers, and his main function is to disperse warrants, paperwork, and to maintain the Dedham jailhouse. He has 600 inmates there, and it's the only jail in the country that's on a major turnpike, 128. So that's something we have in common with. But basically, he wants seniors to be safe. This is the big thing. And he cares. And we have several programs. The File of Life program, you have two forms. One is a wallet size. And on this, you fill everything out in pencil because your medication changes, your doctor changes, your hospital changes. So keep these in your wallet all the time. I was just telling the woman here that I live in Dover, a fellow fell 2 weeks ago and hurt his knee in town, and the EMTs came and they were going to take him to the Framingham Hospital. And he said, no. He said, I have to go to the Beth Israel, look in my wallet. And there was the File of Life card with his medication, his doctors, and everything. So when he gets to the hospital, everything is there. They don't have to start doing all the work again. Same thing for your refrigerator. This will stick to your refrigerator. It's a magnet, and that'll stay on. You do that in pencil also. So this is the things which the sheriff would like everybody to have to be safe. You never know when something is going to happen, and you want to be, protected. We have a program, the Triad program, which is here. It meets here regularly with Ashley. And this is police, fire, and the sheriff's office. And basically, to get together, let you know about scams, how to protect yourself. Just, basically, we want you to be safe. And the Triad works with the police and fire and the sheriff's office and the Council of Aging. So this is a program which everybody should get involved in. Another program we have is the Are You OK program, which you can get available here with Ashley. This is a program which is free. It's 365 days a year. And the Sheriff Bellotti has this set up between 6:30 and 10:30. The sheriff's office will call. It's a computerized call to your home number. The sheriff's deputy listens to your reply, and what they say is, Norfolk County Sheriff's Office, are you okay? And if you don't respond, they'll call back in a few minutes. Again, if you don't respond, they'll call back again. And if you don't respond the third time, out comes the emergency services. They've saved 150 lives with a phone call. And just recently, there was a gentleman who answered, and he said, yes, I'm fine. And the sheriff's deputy said, he didn't sound right. She called back and asked, are you really fine? He said, no, he was having a stroke. So a phone call saves a life. It's free, 365 days a year. So it's a program we can set up, and Ashley will help you with that. The other program we have is the Yellow Dot. The Yellow Dot program, the Sheriff Bellotti would like to have everybody have this. It's your file of life in your glove compartment with your picture, a photograph of the driver or whoever name is on the file of life. You'll have a yellow sticker on your rear window. In case of an emergency or an accident, and the emergency service arrives, They'll see the yellow dot in the rear window, look in the glove compartment to make sure that the driver is the person on the picture, because sometimes someone will be using your car. Then they'll have all your information right on the scene. So these are programs, they're free. Sheriff Bellotti wants everyone to be safe. He wants everybody to more or less exist and have a great life. So this is what we do, besides keeping inmates out of trouble. But basically, this is what the sheriff does. He cares for people, and he has all these programs. He doesn't have to have them, but he really wants seniors to be, healthy and well. Thank you. I'm going to leave you. There'll be some there, yes. And actually, you'll have some too, I believe, in the yellow dot. Okay. Thank you very much. Thanks, Paul.
Thank you. Thank you. Oh, wow, this is loud. But we're being on the cable, so I have to speak into this. I'm usually teach with my own natural voice, which my wife tells me is very loud. So, all right. I'm Lieutenant Paul Delaney, Lieutenant Matt Corder. We run the Public Education Division at the Fire Department, which means we do all the teaching from wee little kids all the way up to the seniors and everyone in between. We work a lot with the Council on Aging and the Board of Health doing programs. And the Board of Health has a grant that is paying for this, and working with Ashley with the COA. So this is a first aid course, and I know the question's coming up, are you going to be a certified first aid today? Actually, you're not, because that would take a 4-hour course, which involves practical testing and all. So what we're doing is we're giving you an overview. We're going to show you, it's a DVD. This is through the American Heart Association. We're going to go over certain medical emergencies and injuries. Then Matt and I are going to do some demonstration on what to do. We brought one of our trauma bags. But just to touch base on that, file of life is great if you have it on your refrigerator, because when we come with the ambulance, we love to see that because it's got all the information. So, also, wow, this thing's, also, those of you who've been maybe to some of my presentations, I like a go-between, ask any question you want of Matt and I. No question is dumb. If I'm going too fast, because we do a lot of teaching, and sometimes I teach too fast, just, Paul, slow down or whatever. But we'll have a fun, fact-based morning here on first aid. Any questions before I start? Yes?
Can I ask you a general question relative to the emergency vehicle? We have a very long driveway, and the front is pretty steep. In a snowstorm, can it go up the driveway?
Yes, he asked a question, and I welcome any questions about our emergency vehicles getting up your long driveway in the event of an emergency. During heavy snowstorms, we put tire chains on the fire trucks, and we can get up there. The ambulance, we may, depending on if the ambulance can't get up, that's why we'll have enough firefighters, we'll get the person down to the ambulance. But we have no problems with snow and fire chains. Hold on, Matt, I'm going to ask you to be my mic guy to bring over to the person. Just hit the button, because, it's all because of the cable.
Will an ambulance take you to any hospital that you request, or are they scheduled to just go to the nearest one?
It depends, okay? If it's a minor call, we're going probably to Newton Wellesley, minor type thing. Certain injuries or illnesses, the paramedics, you got to go into Boston, because people don't realize Newton Wellesley Hospital isn't a trauma center. It's called a community hospital. So there's ER doctors there 24/7, but there isn't specialists there 24/7. The Boston hospitals, we go to Beth Israel, Brigham Women's, Children's. They have specialists 24/7. So depending on what's going on with you, we may be taking you into Boston. Now, it depends too, Newton Wellesley is part of Partners Healthcare, okay, which is Brigham Women's, Mass General. So they have all your records. People get worried. Beth Israel is, we will take, if you're Beth Israel, we will go to the Beth Israel and Needham's turned out to be a great community hospital because they rotate Beth Israel doctors through there. And the wait over there isn't as long as Newton Wellesley. So it depends. We try to accommodate you, but like we had one person, I need to go to Leahy Clinic. No, we can't go to Burlington. I'm sorry. So what we tell the people, we can get you stabilized at Newton Wellesley and they'll transfer you from there. So, got a question here.
What's the difference between the MOST form and the file of life?
The most, totally different. Most form is, that's a form, most form is a end-of-life care form. We used to call it, oh God, I'm drawing a blank, but what it is this is a form, you get signed, has to be signed by your doctor, has to be with you at all times. It spells out what you want for care for end-of-life, okay? Do you want CPR performed on you? Do you want to be intubated, which means a tube put in your lungs? It's totally different than the file of life. You should have both. Yes, and last Friday we had a call of an elderly woman. We got there, she was in cardiac arrest. I started CPR, but then the daughter showed up and said, I got a MOST form, which is we used to call them do not resuscitate forms. It's a legal form. And she showed that. We said, are these your wishes and the wishes of your mom, you think? And she said, yes, so we stopped. So most forms are very important for elderly people to have. I know I had one for my dad, and he died 3 years ago, and it was very helpful. It helps the children or the caregivers of what to do for end-of-life care. And it's done very dignified, too. So, good question. All right. Any other questions? All right. So I'm going to be showing a lot of DVD, and then it stops, and we're going to talk about things.
So Janie tells me she's not playing soccer next year?
I think she's more interested in band, although Kyle tells me she's also in math.
Stop! Did you see that? That man just collapsed on the school lawn.
Yeah, and he's not getting up.
Wow, this doesn't look good.
I hope John knows what to do, because I sure don't.
Okay, remembering the first aid course at work. I need to make sure the scene is safe.
That could be you, helpless, on the ground. Or you could be the rescuer who comes to the person's aid. People can suddenly become ill or injured, regardless of where they live or work. But you can make a difference, even save someone's life, if you learn to recognize and respond to common emergencies. Hello, and welcome to the American Heart Association's Heart Saver First Aid course. In this course, you'll learn the basics of first aid, the most common life-threatening emergencies, how to recognize them, how to call for help, and how to perform life-saving skills. This course will help you learn in several ways. Your student workbook covers all the material and includes quick reference guides. And this video will give you facts and show you important skills. However, not all topics are covered in the video, so it's important to read your workbook and keep it close by. If you complete all the course requirements and demonstrate the skills correctly, you will receive a course completion card. Studies show that you need to review this information and practice the skills frequently in order to maintain your first aid skills. Now let's get back to the scene and see how training in first aid can help you save someone's life.
Can you hear me? Are you okay? Are you okay? Janice, phone 911 and stay on the line so you can answer the emergency dispatcher's questions, okay?
Okay, got it. There's a gentleman on the ground who's unresponsive.
He's breathing normally, so he doesn't need CPR.
We're at Mitchell School on the corner of Elm and Cherry Street. 3535 Cherry Street.
What can I do?
I'm on the phone with the 911 dispatcher. Do you have a first aid kit and an AED?
Yeah.
Hurry and go get those.
What about other problems? Was he injured? I don't see any bleeding, broken bones, or bites. Nothing at all.
What about medical information jewelry?
Let me see. Oh wait, here's something. He's wearing a necklace. He has diabetes.
We just discovered a medical necklace. He has diabetes. Okay, the paramedics are on their way. They're just a couple of blocks away. The dispatcher says to stay with him until they arrive. I'm gonna go meet them.
You just witnessed someone like you putting first aid training into action. It's more than scratches, scrapes, and skinned knees. First aid is the immediate care that you give a person with an illness or injury before more advanced training arrives and takes over. First aid can be initiated by anyone in any situation. It may help someone recover more completely or more quickly, and it could mean the difference between life and death. Most of the time, you'll give first aid for minor illnesses or injuries. But you may also give first aid for something that could become life-threatening, such as providing aid for a heart attack, bandaging for severe bleeding, or giving epinephrine for a severe allergic reaction. Today, you'll get to practice first aid skills, which will help you remember what to do in a real emergency. Let's define some terms you'll hear throughout the course. Responsive refers to someone who moves, speaks, blinks, or otherwise reacts when you tap him and ask him if he's okay. Unresponsive refers to someone who does not move, speak, blink, or otherwise react.
The first part of the first aid course goes into CPR, which I'm going to skip because that's a whole separate type of course. And if that's something the COA is interested in, maybe we can run that's a separate, and that would be a certification course. I think, Matt, you can go to the next. So while Matt's queuing up, the big questions I get about first aid and CPR is, can I be sued if I do something to someone and, they die, and can someone, they sue? You cannot. 1965, the federal law, Good Samaritan Act, covers everyone who does CPR, first aid, to the best of their ability, okay? That doesn't mean you saw on a TV show the night before how to crack open a chest and do open hot chest massage, all right? That's where lawyers are going to get involved. It's just the best to your ability. So what I want to talk about is the 911 system and the 911 system in Wellesley, okay? More and more people we're finding are getting rid of their landlines, meaning a phone actually has a cable to it that goes through town. More and more people have this. The traditional phone in a house in Wellesley, a landline, you call 911, it goes to the police station or emergency dispatch center, and your address, name and address, right on the screen, okay? It's great. Lets us know exactly where the call's coming from. Yes? Yeah, if you have a restricted phone, 911's never restricted. Okay, she asked if some people have blocks on their phones and stuff. 911's never restricted. The law says you have to be able to call 911. Okay. Yes, yeah, but that's private information. That can't be let out to non-first responders, if that's what you're worried about. Yeah. So 911 on cell phones work differently. So if I was to call 911 right here from my cell phone, I wouldn't get the dispatch center across the street. I get the nearest state police. In Wellesley, it's usually the Framingham Barracks, okay? And what they do is get your information and then transfer you to Wellesley, okay? So it's very important when you call 911 on a cell phone to give not only your address or location, but what town you're in. Because sometimes they get confused in translation between state police, you, and Wellesley. We have a slight problem. We've had a few calls with a community about 90 miles to the south of us called Wellfleet, Massachusetts. Wellfleet and Wellesley sound a lot alike. Not only that, they're next to each other alphabetically in the state police computer. So we've gotten a few calls for Wellfleet. Wellfleet's gotten a few calls for us. So 911, be very clear where you are, okay? You know, that's a good idea. I would think, you know, I'll look into that. She asked if you gave your zip code. I'll have to, you know, I've never thought of that. I'll have to call them and see. I'll find that out. It actually would make a lot of sense, wouldn't it? But we're talking state government here, so. Oh, I'm sorry. Is that my outside voice? All right. Yes, sir. Yes, he has a landline with a battery backup, so no power. That will work as long as the battery, but that battery's not going to work long. Really? I've heard of it lasting less than that. So, yes, yep, it will work. So. And I'm sure I don't have to tell this group, but when I'm teaching the kindergartners about 911, I have to tell them, please don't go home and practice calling 911. Because I made that mistake once, and we were going all over town chasing 911 calls. Because what happens in Wellesley when you call 911 and you hang up, they'll try calling back. If they get no answer, they cover the 3 bases. They send a fire truck, police car, and an ambulance. So now I have to make sure when I tell the kindergartners, no playing on it, no practicing on a real phone, okay? Yeah, so. Also, there's also a regular phone number that will get you right to the Wellesley Dispatch Center. It's good to program in your phone. And I'll give it to you, and if come up to me too at the end of the presentation. It's 781-235-1212 is going to get you the emergency dispatch center. I tell people when I'm doing fire safety CPR classes, program that into your phone. That way you could get right to the Wellesley number. So 781-235-1212, and I'll repeat that before you leave too. Okay. So, another thing on first aid, though, you always want to make sure the scene is safe. You don't know why this person is down. We never want, if we have one person who needs help, we don't want 2 people that need help. So the big thing is the scene safe? Why is this person collapsed? Could they be in contact with electricity? You never want to touch someone who's in contact with live electricity, because once you touch them, you become part of that live electricity. Or could it be something dangerous, an accident on the road, and it isn't safe? Just call 911 and wait for professional help to come, okay? So, all right, I think we're going to go into see what happens with seizures, and then we'll discuss it.
As part of First Aid Basics, your role as a first aid rescuer is to recognize that an emergency exists. Make sure the scene is safe for you and the ill or injured person. Phone 911 and provide care until someone with more advanced training arrives and takes over. You become an important part of Emergency Medical Services, or EMS. EMS is a network of emergency responders that you activate by calling 911. Another first aid basic that applies to almost all emergencies is to ask if you may help. Anyone has the right to refuse you. When you come upon an ill or injured person and the person responds, introduce yourself as a first aid provider before you touch the person. Then, ask if you may help. If the person agrees, give first aid. If the person refuses, phone 911 and stay with him until help arrives. If the person is confused or can't answer, assume the person wants help. Also, it's important to know that first aid kits should contain the supplies you'll need in most common emergencies. Your student workbook contains a list of what is usually kept in a kit. Your kit may be different, however, so please check the first aid kit against your list to see if there are additional items you need to add. Be sure to restock it after any emergency. By taking this first aid course, you are benefiting yourself as a rescuer and the ill or injured person. Initially, you may have thoughts like Janice when she and John first came upon the landscaper near the school.
Wow, this doesn't look good.
I hope John knows what to do because I sure don't.
Janice isn't alone in her hesitancy to act. You may be worried about doing the right thing or worried that someone else could provide better care, or even the sight of the injury itself might be overwhelming. Taking the American Heart Association's Heart Saver First Aid course increases your confidence and ability to respond in emergency situations. Just like John, you'll be more likely to help if a family member, coworker, friend, or even someone you don't know becomes ill or injured. And if you have questions regarding whether or not it's legal to provide someone first aid, all states have Good Samaritan laws. These laws protect anyone who provides first aid. They differ from state to state, so be sure to check the laws in your area.
I'm going to skip ahead now for time restraints. This is what I talked about how to call 911 and so on. Matt, if we can get to medical emergencies.
We've talked about assessing the scene to be sure it's safe and taking precautions such as wearing personal protective equipment. Next, you must assess the ill or injured person to find out what the problem is before you give first aid. Let's look at the steps more closely. First, make sure the scene is safe. As you approach, look for what could be causing the problem. Next, check to see if the person responds. Approach the person, tap him, and shout, "Are you okay? Are you okay?" If the person doesn't respond, and you are alone and have a cell phone, phone 911 and put your phone on speaker mode. Otherwise, send someone else to phone 911 and get the first aid kit and the AED. Check to see if the person is breathing. If the person isn't breathing normally or is only gasping, begin CPR. If the person is responsive, ask what the problem is. A person may only be able to move, moan, or groan when you tap him and shout. If so, phone or send someone to phone 911 and get the first aid kit and AED. If the person is breathing and doesn't need immediate first aid, look for any obvious signs of injury, such as bleeding, broken bones, burns, or bites. Finally, look for any medical information jewelry. This tells you if the person has a serious medical condition. Finding the problem is a skill you'll be tested on, so watch this demonstration, and afterwards, you'll get a chance to practice.
The big part there, I just wanted, people with chronic medical conditions will have medical emergency bracelets. The most common are diabetics. They either be around their neck or on their wrists, saying diabetic. Epilepsy, people who have epilepsy, which causes seizures, will have that. So that's a big clue, especially for when we get there, of what's going on. We can skip that, Matt. See, this is really a 4-hour course, so I want to get high points. If I can get to medical emergencies, Matt. I apologize. I got an older computer and it's having trouble catching up.
In this part of the course, we look at the first aid actions for medical emergencies, including difficulty breathing, choking, heart attack, bleeding, and stroke. Your actions in the first few minutes when you see the signs of any of these conditions could help save a life. Breathing. It's usually smooth and easy. We run, play, go about our daily lives, and hardly even notice it. But if someone suddenly has trouble breathing, it's an emergency.
Let's go! Move up! Move up!
Antonio, pass!
Shoot! Nice! That's more like it! Josh, Josh, are you okay? Is it your asthma? Okay, where's your bag? Okay, hang on.
You can tell if someone is having trouble breathing if the person is breathing very fast or very slowly, is having trouble with every breath, has noisy breathing, you hear a sound or whistle as the air enters or leaves the lungs, or can only make sounds or speak no more than a few words at a time in between breaths, although the person is trying to say more.
Is this the right medicine? Here you go.
Someone with a medical condition, such as asthma, usually knows about his own medical condition. He often carries inhaler medicine, which can help him breathe easier within minutes of using it. At times, the person can have such a hard time breathing that he needs help using his inhaler.
So you can help someone with an inhaler. They'll know how to use it, but you can help hold it. If they don't get better after 1 or 2 doses, 911 needs to be called because we can give more medicine. If the question is if they don't have their inhaler available, call 911 because on the ambulance we have medicine, breathing treatments.
To assemble an inhaler, first shake the medicine. Put the medicine canister into the mouthpiece, remove the cap from the mouthpiece, attach a spacer if there's one available and if you know how. To help someone use an inhaler, have him first tilt his head back slightly and breathe out slowly. Have him place the inhaler or spacer in his mouth and push down on the medicine canister, and then breathe in very deeply and slowly. Then have the person hold his breath for about 10 seconds, and then breathe out slowly. Also, it's important to know that there are different kinds of inhaler devices. To summarize, follow these steps for someone who is having breathing problems. First, make sure the scene is safe. Ask the person if he needs help. If he does, ask if he has medicine. If he has medicine, get it for him and then assemble and use the inhaler. Phone 911 if the person has no medicine, the person does not get better after using his medicine, the person's breathing gets worse, the person has trouble speaking, or the person becomes unresponsive. Provide CPR if the person becomes unresponsive and stops breathing or is only gasping. Stay with the person until someone with more advanced training takes over.
This is adult choke, and we're going to watch the video. Then actually, I'm going to teach you people how to do the Heimlich. This is a simple thing.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look.
If you look at page 2, there's a high-level view of the company. Actually, you know what? I think I have my own copy. Right here. Are you choking? Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away and try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around the person's waist so that your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrust instead of abdominal thrust. If you give someone thrust but cannot remove the object blocking the airway, the person will become unresponsive. Watch to see how this might happen and what you should do.
Sir, can you help me lower him to the ground?
Choking is a very common thing, and it's one of the most easiest medical emergencies that the layperson can do. You've probably heard of it called the Heimlich maneuver, named after Dr. Heimlich, who died this past year at the age of 94. He came up with this in the 1960s to relieve choking. You probably remember the old way was always to, hit the person on the back and stuff. Well, that didn't really work, as he came up with taking air from the diaphragm and pushing it up through the esophagus and out. And trust me, I've done this. It works. It works the first time, maybe the second time. I've never seen it not work. So here's my question to the group. What is the most common age of a person who chokes? I hear 70. It's kind of, hold it, we got someone who's been into one of my classes. It's a middle-aged male. You're looking at him right here. All right? Middle-aged men are the most common people. Usually I get the elderly or children. Middle-aged men are the most common to choke. First of all, because we like eating large pieces of meat, okay? But a lot of things that happen with choking revolve around alcohol. So to give you my brief medical physiology of the human body, you have two tubes. The trachea, which is your airway to your lungs. The esophagus, which is your food tube, okay? And when you eat, you have a thing called the epiglottis. You don't even realize it's doing it, but it voluntarily just covers the trachea. It's like a flap of skin, okay? So you swallow, so your food goes into your stomach, not into your lungs. Well, alcohol, makes us feel pretty good and doesn't make the body work as well. It kind of numbs that epiglottis, doesn't work as well. So usually middle-aged men in a restaurant, over drinks, complaining about their golf game, will choke. It's the most common thing. So right now I'm going to have Matt demonstrate on me how to do the Heimlich maneuver, and then we're going to have you try. We're not going to really try this, because to do this right, I would probably lift some of you right off the ground, because it's that much force. But the main thing is, someone might say, oh, I'm choking. We've all had that. We've had that. It's in no man's land there, and you're like, ah. Sometimes people say, I'm choking. If they're speaking, they're breathing. Breathing equals not choking, okay? That's why the first thing we always want to ask is, can you speak? If they can't speak, they're choking. If they're coughing forcefully, that means, and making a noise, that means they're getting air, okay? And we want them to continue with the gag reflex to cough that up, okay? I'm going to be on the mic, so yeah, I'll talk through it as you. So I'm having my nice steak here with my craft beer, and I get up, and Matt goes,
are you choking?
And I can't speak.
I know the Heimlich.
So he gets behind me, and you see, let's back up so everyone. He's gonna put his leg in between mine. That's so if I pass out, he can kind of guide me down and we don't fall over together. Now he's gonna make what we call a fist. Go right above my belly button. And as hard as he's just, even that's showing it, as hard as he can, he's gonna come inward and upward. And what that do, it's gonna work. I've never seen it not work. Force air out and that object will come flying out. Okay? Yes?
What if you're a little person and a big man is sitting there and he didn't get up, he didn't stand up? Can you do it?
Yes. If there's a heavy person in a chair, it's the same we do on a pregnant woman. Instead of doing it in the abdomen, we do it in between the breast, even on a male. It's not as good, but there is some air in here. So he'd be in the chair like this, and I could get around like that. Yeah. Yes. A child, okay? A child is a little different, okay? It's kind of a separate, if you see me after class, I can explain it more. You do it, but you do a modified. It's a modified. But when we're talking adult and choking, it's age 8 and above. 8 and above is considered an adult in CPR world, okay? So, yes, sir. Yeah. No, never reach in. He asked if should we reach in to someone's mouth to try to get an object. Someone who's conscious, trying to breathe, will bite your finger and bite it bad. Never put your hands into anyone's mouth, whether they're conscious or unconscious, because you don't know. They could bite down. Got a question back here. If you're alone, they say you can do it on yourself, but I feel if you can't breathe, you're panicking. That's when I would call 911 and put the phone down. But there is a way you can do the Heimlich over a chair, but I've never heard it done. I would think if you're breathing, you're not thinking straight. I would try to get somewhere outside where there's public. Yeah. That's a good question. How much time do you have when someone's choking, they pass out? Only a couple minutes, because once they're without air, they're going to lose consciousness. That's why it's important to get this done right away. Yes, question back. Yeah, I feel like Phil Donahue. I know I'm dating myself. Yes, we don't hit people on the back anymore. That can lodge it even worse. The only ones we hit on the back, and it's a totally different, I'm not even going to get into it, are babies, infants. And that's totally different. Yes, sir.
As far as you know, is any of the flight crew trained in...
Oh, yeah. Flight crew? They like to be called flight attendants, I found out. No, I'm just kidding. Yes, they're all trained. And there's defibrillators. And restaurant staff, doesn't the Board of Health, the restaurant, they have to be through the Board of Health, Cheryl? Not through you? Okay. One person per shift at least has to be. Excuse me. Teachers, yep. Teachers, yes. That's kind of a gray area. Wellesley is more proactive. I do a lot of the school teachers with CPR, which when I teach CPR, I teach choking too. What's that meant? Oh, all athletic coaches now have to be CPR certified. And when I say CPR, they're trained in choking too and defibrillation. So, sure. Yep.
And also about not back on what someone else talked about. Don't
Yeah, I'm going to touch base on that with seizures. Do you know defibrillators? Defibrillators, have you heard of them? We call them defibs. They're what they do is basically they've been a game changer. They jumpstart the heart in conjunction with CPR. They're in every town building. Like here, they got a sign out there. They're in every town building, all the schools. State law says now the coaches, they have to be out on the fields. Not with like private, not with like Little League. This is like Massachusetts Athletic, the state body that governs sports in Massachusetts. That's a defib, the life pack. They're on all airplanes. I was just on an airplane last week. Every police car, firefighting vehicle has them. So, and there's usually a sign up. And a lot of the private businesses now, like Roach Brothers has them. The big office buildings in town have them. Country Club, all the colleges. Yes?
If that was used on someone who didn't need it, or the person didn't realize it wasn't needed, could it harm?
You cannot, she asked could you use the automatic defibrillator on someone who doesn't need it? No. It won't work. They're totally what we call firefighter proof. If we can run them, anyone can run them. Okay, it's all computerized. It will not shock someone who doesn't shock. Yeah, so. It wouldn't work. Wouldn't work. Nope. All right. Where are we here? What we're bringing up now is allergic reactions. Do you know what? Allergic reactions are a real medical emergency, okay? Okay, stop it. Yeah, stop right there. Allergic reactions we're seeing more and more of with kids. You know, nut-based allergies, food, egg, dairy allergies, latex allergies, and latex is in everything nowadays. So all our medical gear on the ambulance is latex-free. So what happens with allergic, this isn't like I'm having allergies because of the pollen. This is what we call a true emergency. They're having such a reaction that their trachea swells up and they stop breathing, okay? So what they need is what we call EpiPens. And I bet you I forgot to bring an EpiPen. EpiPens, have you heard of the EpiPens? Anyone here have one? Maybe. Yeah. So what it is, it's a shot of epinephrine. What it does, it reduces the swelling in the throat so the person can breathe. Classic signs of someone in allergic reaction, we call it anaphylactic shock, is they'll break out in hives. You'll see the hives. Their throat will become dry and start closing. Lips become swollen. And by giving this shot, most of them will have an EpiPen on them and will give it themselves or will give it. We have it on all the fire trucks and police cars. And what it is, I think the video is going to show it. It's basically a one dose. We put it right into their thigh, and it works incredibly. My wife's a school teacher. I bet you she has 6 or 7 EpiPens in her classroom. Just childhood allergies are just, I don't know, I'm not a doctor, but we're just seeing so many childhood allergies. And EpiPens everyone has. So let's watch the video. I believe it shows the EpiPen.
Allergies are quite common, but if severe, an allergic reaction can quickly turn into a medical emergency. Symptoms of mild allergic reactions are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or signs of shock. An epinephrine auto-injector is a prescribed device that has medicine in it. The auto-injector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine auto-injector, he will generally know how and when to use it. You may help give the person the injection if you have been trained and your state allows it. In a moment, you're going to practice using a spring-activated epinephrine pen. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention because you'll be demonstrating the same steps to your instructor afterward. First, make sure the scene is safe. Phone or send someone to phone 911 and get the first aid kit and the AED. To use the epinephrine pen, follow the instructions on the pen and make sure you are holding the pen correctly. Hold the pen in your fist without touching either end, because the needle comes out of one end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. Hold the pen in place for about 10 seconds. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pen to paramedics for proper disposal. If the person doesn't get better, or if there is a delay greater than 10 minutes for advanced help to arrive, consider giving a second dose, if available. Okay, now it's your turn to practice using an epinephrine pen. While the video is paused, you'll pair up with a partner and take turns practicing, and then your instructor will test you afterward.
When they said a second dose, that means there has to be a second pen, because the EpiPen's one dose. And what it is you saw that you take off a blue tip is the locking mechanism, so it doesn't go off while it's being held. And the key is with people, sometimes they get nervous. They put it in and take it right out. Well, then the medicine isn't going in. You need to, I like to say 1,000, 2, 1,000, 3, 1,000, 4. Okay? And the reason if someone's bad enough that they need an EpiPen, we need the paramedics coming, because they have some more drugs that can help. And this person is going to need to go to the hospital. And EpiPens it's a prescription medicine, so the person has a prescription from a doctor. So, any questions on allergies? Yes? Yes, it's a nasty needle. It hurts, but the person doesn't mind it. So, yeah, it's made, that's so the lay person, when we do it, we take the pants down and do it, but that's so the lay person doesn't worry about taking someone's pants off. So, question over here. Some do. I don't see much on the allergy. Some do. The most I see on bracelets are diabetics and epilepsy. Yeah. Right, but we can tell by the telltale signs they're having, and they'll tell us too. They know what it feels like. So, did I have a question over here?
Yeah, it will discharge by itself. You don't
Yep.
have to push.
When you put it in, it discharges by itself, but you got to hold it there for 10 seconds. No, it won't harm, but it can kind of make a second dose won't harm, but it's going to make their heart beat really fast. So that's why they need to go to a hospital, just to make sure of that. I think I've only seen it once when I've done it that we needed 2 doses, because our ambulance was tied up, so the fire truck gave another one after 5 minutes. But another thing, that they're such a lifesaver, and they're very. I heard someone say you have one for your grandchild. You know, children and allergies is It's amazing. It can be something as simple as peanuts in the air with kids with severe peanut allergies. They don't touch it, just the peanut smell. I know my wife's second grade classroom is a allergy classroom, so they got the kids in there, so there's no peanut butter coming in and all that stuff. So, yes, sir. You have to ask the American Medical Association for that. Beyond I don't know, it's a drug, so it has to be prescribed. But they give them, they don't, a doctor will not hesitate. When we first got these on the fire trucks about 12 years ago, we used to have to go through all this protocol, take vital signs, make sure. Now our medical control, who oversees us on the ambulance, says when in doubt, EpiPen. So. No, because they're going to die if they don't have it. So, yeah. She asked if there was people with heart problems. No. All right. Let's go to heart attack now. So the person you're going to see was me during the Super Bowl this year. When Tom Brady threw for 500 yards and we lost because a certain player wasn't playing on defense, but why diverse there?
So if we could just maintain the momentum we've had so far, looks like we can just keep up our profits for over the summer.
But why don't we add a new product line now when it's slow, and then we could increase production in the fall?
No, not such a good idea. If I could just try, tell you.
George, what's going on? You keep rubbing your chest.
Oh, I don't feel so good. Oh, it's no problem.
Listen, George, I'm trained in first aid. Can I help?
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and phone 911 right away, even if the person doesn't want you to. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. Also, many of the treatments for heart attack will be most successful if they are given quickly.
Yeah, I guess so.
Okay, tell me what's wrong.
It's just my chest feels tight. It feels like something is squeezing it. Oh, I'm starting to feel sick to my stomach. If I could just sit down for a minute, I'll be fine.
Alicia, phone 911. Tell them we have someone with tightness in their chest.
Got it.
And Joe, could you get the first aid kit and the AED? They're in the break room.
Yes, there's a man here. He's having tightness in the chest. He's sweating a lot and he's nauseated.
No, wait a minute. It's just some leftover heartburn. I just don't want to make a big deal.
Listen, George, do you have any allergies to aspirin?
No.
Have you had any bleeding lately? Have you ever had a stroke?
No, neither.
Yes, it's 8200 Bell Street.
George, I'm going to give you one adult dose aspirin. Chew that up and swallow it.
Okay.
We've just given him one adult dose aspirin.
Okay. Thanks.
Paramedics are on the way.
One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. But what about the difference between a heart attack and cardiac arrest? We often hear these two terms used as if they are the same, but they are not. Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing normally or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle normally nourished by that vessel begins to die. A heart attack can lead to cardiac arrest. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911, ask someone to get the first aid kit and an AED. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have the person chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive, be prepared to provide CPR. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery.
Okay, heart attack. Men tend to show the classic signs of heart attack: the real chest discomfort, pain, sweating, feel like throwing up. Women, and I don't know why this is, I'd have to have a cardiologist, but when I've been to classes, women don't always present that way. Women a lot of times have what we call silent heart attacks. They don't have all the outright symptoms you see in a man. A lot of times people with chest pains, they always say it's indigestion, okay? When in doubt, call 911 with chest pains. What happens with us when the paramedics arrive, we can do an EKG right on the scene, and we can tell if the person is having a heart attack, okay, by the EKG. The reason it's good to give aspirin is a blood thinner, and heart attack is usually is a blockage in the heart, so that can help relieve maybe the blockage. But someone who's had a history of stroke or you've heard of blood thinners like Coumadin and stuff, we do not want to give aspirin to, because that can cause bleeding even more. So it's very important with signs of a heart attack to call 911. And depending what we see on the EKG and the ambulance, Newton Wellesley Hospital is not what we call a cath lab. What a cath lab is if you're having a heart attack, they shoot dye in your thigh and x-ray your heart, and it'll show the blockage. So we have to go into Boston for that, okay, to one of the Boston hospitals. So that's why it's imperative, early onset, someone having chest pains, to call 911. 9 out of 10 times on our chest pain calls, they're not having a heart attack. In 2012, I talked myself into chest pains at the fire station because I teach CPR, I do all this. I had just put my mother in an Alzheimer's home under a lot of stress. I talked myself into every one of those symptoms. I thought for sure I'm having the big one. And of course I wasn't, it was stress related. A lot of chest pain, people think they're having heart attacks, it's stress related. So now I know we got questions. Yeah, and you know what I like? Baby aspirin, because he can chew them. Buy baby aspirin. You're not on any blood thinners or anything. Get baby aspirin. I don't know, whatever you chew them, right? But baby take 2, and then you got the adult, and you can chew them. That's the way you can't swallow. So, did I have more questions? I'll be right over to you. Yes. Yes, Framingham Union does have a cath lab, but we're kind of here. We can shoot right down Route 9 to Beth Israel. Yeah, they might. So, question over here. Yeah, they don't always. Yeah, there can be, but they're not as pronounced as they are in men, like with the jaw pain, chest pain going down the left side. We always ask on a scale of 1 to 10, 1 being the least and 10 being the worst pain you've ever had, what are you? And I've heard people who are having heart attacks say it's like an elephant's on my chest. And a lot of times they'll feel like throwing up too. And if they're sweating and don't look well, call 911. Like I said, whenever in doubt, you're not sure it's something, we're here 24/7 in Wellesley. Just call 911. Okay? Okay. Any other questions? I'm sorry. Okay.
Fainting may occur when someone stands without moving for a long time, especially if it's hot, has a heart condition, suddenly stands after squatting or bending down, or receives bad news. Fainting is a short period of time when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy and then becomes unresponsive. If you're asked to give first aid for a person who is dizzy but still responds, make sure the scene is safe. Help the person lie flat on the floor, and phone 911 if the person doesn't...
I'm watching the clock here, so I'm going to talk over a few, like fainting. You don't need to see the video. And Matt's going to line up stroke, which I think is important. Then I want to get to the trauma type things, bleeding and things. People faint all the time, and usually it's nothing. The only thing when you got to watch out with someone who's fainted, and when we get, is sometimes it can be heart related, cardiac related. For some reason, their heart may be not beating right, and there's a little interruption of blood, oxygenated blood to the brain, which causes them to faint. So after I had the heart attack with the Super Bowl, I think I fainted then. So 9 out of 10 times fainting is nothing. It's the body's reaction to some type of stress, and they're calling a timeout. So seizures. Seizures are to the layperson, it's the most scariest medical emergency to see, because the person having a seizure is basically the electrical current in their brain is kind of short-circuiting. So they're moving all around the ground and all, and a lot of times they'll bite their lips, so they're bleeding. Remember, the old school was a seizure patient could swallow their tongue. Totally impossible. You cannot swallow your tongue. Remember, they used to say put something in their mouth for them to bite down on. You don't need to do that, because it can't happen. You do not want to put your fingers near a seizure person's mouth, okay? Because they'll bite it, and bite hard. So seizure patients, call 911. Most likely they've got a condition. The seizure will last a minute or two. Just get things out of the way, because I hate to use this term, but they're flopping around, okay? And get 911 coming, okay? Because seizures usually they have epilepsy, maybe they didn't take their medicine, or they're getting their medicine adjusted and so on. Also, seizures can be a sign of something else. If someone has a seizure that doesn't have epilepsy, they need to go to the hospital for a brain scan. They could be bleeding in the brain or a brain tumor or so on. So I want to get stroke. Any questions on seizures, fainting? Okay, we're going to talk about stroke. Stroke is basically a heart attack, but in your brain.
Stroke is another medical emergency for which you may need to use your first aid skills. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, It's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST method to recognize the warning signs of stroke. It's a simple way to remember the warning signs of stroke, which are face drooping. Does one side of the face droop or is it numb? Arm weakness. Is one arm weak or numb? Speech difficulty. Is speech slurred? And time to phone 911 if someone shows any of these symptoms. If you see these signs and think someone is having a stroke, take these actions. First, make sure the scene is safe. Phone or have someone phone 911 and get the first aid kit and AED. Note the time when the stroke signs first appeared. Remain with the person until someone with more advanced training arrives and takes over. If the person becomes unresponsive and is not breathing normally or only gasping, provide CPR.
There's two types of strokes. There's the blockage kind, which is like a heart attack, which an artery going to your brain gets blocked. So that part of the brain that's blocked isn't getting oxygenated blood and they have a stroke. Okay? Then there's a, what we call, you've heard the term aneurysm. It's a blood vessel has burst. They're bleeding in the brain. That's also a stroke. That's not a very good sign. They need a neurosurgeon right away, someone who's bleeding in the brain. Okay? Stroke, though, they're classic signs. The side they're having the stroke on, the face will be drooping. They'll definitely have trouble talking. And hold this mic. I'm trying to demonstrate something and be able to talk to the mic. Actually, Matt, go up. What we do when someone's having a stroke, the first thing we're going to do is watch Matt. Can I volunteer you? Put your arms out. Put your arms out. Close your eyes.
Usually what happens is when they get their arms out, when the patient usually has their arms out, they can see their arms out there, and they can compensate for the kind of the drooping of the arm. Once they close their eyes, they can't see, so it feels like their arms like this, but usually one arm will droop down depending on which side the stroke is on.
And do the squeezing too.
And then, can you squeeze my hands? Wow. Awesome. So usually what happens is with the stroke, one hand squeezes tight, the other doesn't squeeze at all. They think they're squeezing me really tight, but I'm only getting squeezed on one side. And then usually we have them smile too. Give me a big smile. Beautiful. And usually with the stroke, one side of the face droops, so you get kind of a crooked smile.
And those are classic stroke symptoms. And there's a time frame with a stroke. We need to know when the stroke happens, because if within a 2-hour window of a stroke at the emergency room, they can give a drug, and what it is a clot-busting drug. But after 2 hours, they can't give that anymore because it thins the blood so the person can bleed out. So it's very important. Unfortunately, my dad, living alone, I found him on the floor having a massive stroke. And I begged with the hospital because he was half dressed. And he used to get up 7:30 every morning. I was there at around 9:30. I begged the hospital, can you give that drug? And they said, no, it's too long. And long story short, he was paralyzed and ended up passing away from the stroke. But he had those classic signs, the face drooping and everything. So get 911 coming right away with stroke. So any stroke questions? Yes, sir. Yeah, you know what? I'll talk about. They're very useful, but he asked about those first alert. I'm going to touch base with those at the end. Yeah. Yeah, I'll get into that at the end because my dad had those, but I'll explain what happened to him with one of those. We're now going to go into injuries. Oh, was there a question? I'm sorry. A headache, that you will not believe is so bad. I mean, the headache that you got to lie down. Well, it depends how bad the bleed is. You know that if it's a, you know, that's it. We get you to the hospital. You need a neurosurgeon. You know, if it's a small bleed, they may leave it and it will clot on its own. If it's big, that's when they. But that's a true emergency. We need you in Boston right away. So, yes, sir. Yeah, mini strokes are called TIAs. They're small. You don't even realize you're having them. They're small blockages in your brain, but then they break up. They think my dad, and now that I look back a couple days before, sometimes he was a little confused. They think he had a bunch of smaller strokes, TIAs, and then he had the big one. So
there is a negative effect from the small TIAs? Or
it can be, or some people have them and they're fine. Right. So, all right. Now we get to some of the gory stuff, the blood, you know.
In this part of the course, you learn about injury emergencies. This includes external and internal bleeding. Bleeding can quickly become life-threatening if not controlled. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a person can lose a lot of blood within minutes. Minor bleeding occurs from small cuts or scrapes. Most bleeding can be stopped with pressure. It's important to stay calm. Bleeding often looks worse than it is. Let's go to a scene where a store employee was cut by broken glass. Watch closely how another employee used her first aid training to stop the bleeding.
Ah! Lisa, I need your help.
Tom, are you all right?
I cut myself.
Sam, can you clean this up before someone else gets hurt? Let me see your arm. What happened?
I mean, I just grabbed the frame, tried to put it on the wall, and it just slipped from my hands.
All right, it's all right. Remember, I took that first aid course. Let's go over to this counter.
Okay.
I'm gonna get the first aid kit. Put this gauze on the cut and press down while I get my gloves on.
Okay. I would have never thought this would happen to me.
It's all right, things like this happen. All right, I'm gonna try to get the bleeding to stop, but I'm gonna have to press down hard, okay?
Okay.
Okay, it's bleeding through, so I'm gonna add some more gauze.
Can you take the old one off?
No, it might pull out some clots and make the bleeding worse. I'm gonna push down a little harder with this extra gauze, and I think we can get the bleeding to stop with a little more time and pressure.
Okay.
Okay, looks like the bleeding has stopped. Let's get a bandage on it. There you go.
Thanks.
Lisa is able to stop Tom's arm from bleeding with direct pressure and the use of dressings and bandaging. Let's talk about the difference between a dressing and a bandage so that you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a bandage. To stop external bleeding, take the following first aid actions. First, make sure the scene is safe for you and the injured person. Send someone to get the first aid kit. Put on personal protective equipment. If possible, have the person apply direct pressure. Apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area. Use the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding is stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. For minor cuts, wash the area with soap and water and then apply a dressing to the wound. Now, we'll show you a demonstration of the steps for stopping external bleeding. You'll practice what you learn afterward, so pay close attention. First, make sure the scene is safe for you and the injured person. If appropriate, have someone phone 911 and get the first aid kit and AED. Put a dressing on the wound. Apply direct pressure on the dressing. Use the flat part of your fingers or the palm of your hand. If the injured person is able to do so, ask him to hold gauze to the wound and apply pressure while you put on protective gloves. Then, let him know you will take over. If the bleeding does not stop, apply more dressings on top of the first and press harder. Keep pressure on the wound until it stops bleeding. Do not remove any gauze once it's in place. After you have used direct pressure and dressings to stop the bleeding, apply the bandage over the dressings to keep pressure on the injury, protect it, and secure the dressings.
All right, Matthew's going to demonstrate. Let's say I was working in the kitchen and I cut my arm with a sharp knife and I'm bleeding, and he's going to demonstrate the correct way to stop bleeding. He doesn't realize I'm bleeding to death over here while he tries to find all this.
You don't have the first aid kit. What is the best type of thing to use immediately?
Towel, any type, yeah. Yep.
It's got to be clean.
Well, if it's to stop bleeding, we can treat the infection in the hospital. Or we can cut the arm off, too. All right, Matthew, you finally came to me. As I'm starting to get a little woozy here from lost.
All right, so what we're going to do is you got a Band-Aid. This is a really big Band-Aid just for demonstration purposes. We're going to simulate making that with the dressing and the bandaging. So, conveniently, Paul has a wound right here. You take the dressing, anything, towel, shirt, or if you got some of this medical stuff, put that right in the wound and use direct pressure. That's the first way you want to stop the bleeding. What you can do is just basically press the wound shut, put some pressure on it, and you're hoping that the blood will clot and it'll stop itself. Now, if it bleeds through that, you just keep adding more gauze to it, more whatever you have around. So once it stops, you want to secure it in place. So this kind of acts like the sticky part of the Band-Aid. This is roller gauze right here, and you just wrap it around sort of tight just so it'll hold, and this stuff will actually hold to itself so it won't come undone. So you can just keep wrapping, give it a good tight wrap. Sometimes you might have to, just because of the loose ends, add a little bit of tape on if you have that. And now this is perfectly dressed. Afterwards, you want to just raise it up, elevation. So basically, you're going to be draining the blood out of the arm, or it makes it hard to pump blood up here, so it'll have less pressure and less likely to squirt blood out. Then, yeah.
And never, once you seal it, don't open it up to look, because that can release all the work you've done.
You'll just pull the scab right off.
Yeah.
And you'll start from square one again.
And if the bleeding didn't stop, he could repeat this, put another 4x4 and another gauze.
You could make it this big if you have to.
You know.
Popeye arms.
Yeah, yeah. So, yes. Yes, the question was tourniquet. Not really for you people, but do we? I don't,
Some stuff. Do you want to make one, or do you want to use the commercial one?
I'll show you what a commercial one, the ones we're using now on the fire truck. When I first became an EMT in the late 80s, we were told by doctors do not put tourniquets on, because by putting a tourniquet on, you're cutting the blood to the limb, and they're going to lose the limb. Well, the wars in Afghanistan and Iraq, the Boston Marathon bombing, have showed that tourniquets save lives, and you do not lose a limb by putting a tourniquet. This is what we carry on the fire truck. It's a commercial tourniquet. They came out of the military. So, I want to do my arm. Yeah, let's say I hit an artery, and there's two types of bleeding, artery and vein. Thank you. Artery is going to be bright red blood, and it's going to be spurting because it's coming from the heart. A vein bleed is more darkish red, and it's not going to be spurting because it's returning to the heart. Artery cuts are more serious to stop because of the splurting. So let's say I really almost cut my limb off here, and to save, this isn't, you wouldn't have one of these at home, but I'll just show you what we're now using in the field and how easy they are.
So with the tourniquets, either really bad bleeding or the arm's almost, or the body part's almost amputated. So what you want to do is you want to stop the bleeding completely. So we have this commercial one, you slide it on. We're going to say the wound's right here. We go a couple inches above. You tighten up this. I'm not going to go all the way, but you basically tighten up this tourniquet really tight. It's going to actually hurt the patient because it's going to be squeezing off all the blood flow to their arm. It's actually going to feel like their arm fell asleep on them, but painful. So this is real tight, and we have this windlass right here. Basically, you just twist this, and it really cinches down to the arm. And you keep cinching down till the blood flow stops. And this locks in here, and then you seal it, you kind of close it in with this Velcro strap so it doesn't go anywhere. And you write the time on it. It's important to have the time noted so doctors know how long that tourniquet's been on. And once we put this on, just like with the bandaging, you don't take it off. This stays on and you let the hospital take it off. And this will stop all the blood flow below it. So the person, we could possibly save the arm if it's still intact, and it'll stop the blood flow so the person won't bleed out. And again, if you can, elevate them. If you can't, don't worry about it. It's important just to get them to the hospital because it's a real important doctor job.
Someone's bleeding that bad, they need a tourniquet, you better have 911 coming. And homemade tourniquets, you can use a belt, but a belt you can't always get as tight because, you know, the holes. Maybe you could get cut like a sheet type, something to do it. But don't do anything thin like fishing line or anything, because that'll just cut through the arm. Yes?
So if the arm is blue, do you still use your tourniquet?
If the arm is what?
Blue, your fingers.
Yes, you can't stop the bleeding, use a tourniquet. These are what we call cravats. We use them for different things like slings and stuff on the ambulance. But they can be used quickly, in a pinch could be used as a tourniquet.
So instead of that commercial easy Velcro one, we're going to use a cravat, which basically you just cinch it down like that. So that simulates you tightening down the tourniquet right away. We'll use this stick right here as the windlass to simulate that. Then you tie this in. And then you just twist this. You keep twisting and twisting and twisting until the bleeding stops. And then you take whatever's left over of the extra piece of cravat, you cinch it down, or you put some tape over it just to hold it so it doesn't loosen up.
And tourniquets can only be used on arms and legs. Don't put it around someone's neck. Unless you don't like them. All right. Any questions on bleeding? I'm sorry I'm rushing because we're getting low on time and I got a few more things I want to get to. Like I said, if you can't stop bleeding, don't hesitate. We've gotten calls to people with nosebleeds they can't stop. And and you think, oh, why are they calling an ambulance for a nosebleed? Well, these nosebleeds, they're bleeding a lot and they need to be cauterized in the emergency room. So any bleeding you really can't control, just call 911, okay? Any questions? Bleeding. Where are my people? You have all my usual asking questions? It's not dumb. So, oh, well, hold it. I'm Irish Catholic. Are we going to talk about? No.
I'm actually a first aid nut, I really am. And I was watching you here and thought, could you use a nylon stocking?
Sure. That's actually a good idea. I thought you were going to another area when you said girl thing, and I started freaking out. Okay?
What would I have handy?
Actually, that's an excellent idea. That nylon stocking as a tourniquet, that would be perfect. And you know what that would work good on? Tying down the bandage, too. That was not a dumb question. That was very good. You do, all right. A belt, yeah, the only problem with the belt is, it's hard to get it tight, but in a pinch. Shoelaces can be used in a pinch, although they're a little thin. But nylon, all right, that's a... yeah. No. Let's just touch on amputation.
First, make sure this...
I'm just going to touch on amputation. If you got an amputation in a home, you've got a serious problem, then you definitely need 911. But the key with amputation, especially fingers, we've had a few carpenters in town cut fingers off. And the key I want to show with them is, I know it sounds gory, but we need that body part because they can reattach them. So just going to show you. I think this is the one where the girl, I don't know, the child cuts his finger off, and his parents are so calm and relaxed.
One external bleeding injury that may seem overwhelming is traumatic amputation. Amputation occurs when any part of an arm or leg is cut or torn off. It may be possible to reattach amputated fingers or toes. And because of this, it's important to know first aid actions to first stop bleeding by using pressure and possibly a tourniquet, and then to protect the amputated part.
It looks like the bleeding has stopped. Austin, keep holding your hand like we told you to. I'm sorry, I know it hurts. I'm gonna put you on speaker mode so you can tell us what to do.
Okay, first get plastic bags that you can seal and put ice in one of the bags.
Okay, I'll get the bags and ice.
Okay, we've got the bags and we've got the ice. Now what do we do?
You need to rinse the finger off in water and then cover it with clean dressing from the first aid kit.
Okay, just kind of wrap it?
Yes, and then place the finger in an empty plastic bag and seal it.
Okay.
Austin, I know you're hurting and upset, but it's gonna be okay.
Put a small amount of water in the bag with the ice. Then put the dry bag with the finger in it into the bag with the ice and water. But avoid putting the finger directly on the ice.
Got it.
Label the bag with your son's name, today's date, and the time.
Okay, I've got a marker, I'll do that.
To take care of the amputated part, rinse it in clean water, then cover it with a clean dressing and place it in a watertight plastic bag. Place the bag in another container with ice or ice and water, and label it with the injured person's name, the date, and the time. Make sure the body part gets to the hospital with the injured person. Remember, do not place the amputated body part directly on ice because extreme cold can injure it.
So the key there is, you want the finger to be, I just want it to be dry. I don't want it to be on ice. So in a plastic bag, sealed, hand it to us. You don't have to go through these bag of ice, then another bag, and God forbid you don't have a Sharpie marker. But nowadays, they can reattach body parts. So that's my gory amputation. things. Any questions? We're going to go into broken bones, okay, and what to look for. There are two types of broken. The old term used to be compound fracture, which means the bone is sticking out of the skin. We call that an open fracture, and the other type is a closed fracture. So.
All right, you guys, bring it on in. Let's finish up some stretching, and then we'll start off with something basic, maybe some round-offs.
Ow! Oh, Coach.
What happened?
I was trying a tumbling pass, and I hadn't warmed up, and I just landed funny.
Well, can I take a look at it?
Yeah.
Okay, where does it hurt?
Right here.
All right, you may have sprained your ankle. Sophie, go get the first aid kit. It's in the break room, okay? And Anne, go and get a bag of ice, put a little bit of water in it, grab a towel, okay? It's in the break room too.
Injuries to bones, joints, and muscles are common. But without an x-ray, it may be impossible to tell whether or not a bone is broken or the injury is a sprain. Either way, you'll take the same first aid actions.
All right, here you go, careful. All right, now this is probably gonna be a little cold, okay?
Okay.
How does that feel?
It's okay. Coach,
yeah?
What am I gonna do?
Well, you're probably gonna have to stay off of it for a little while.
This couldn't happen at a worse time.
I know. Well, this will help with the pain and swelling, okay? Keep this on for 20 minutes, then take it off. No walking on it, definitely no tumbling until you get this checked out.
Okay.
First, make sure the scene is safe. Get the first aid kit. Wear personal protective equipment. Cover any open wound with a clean dressing. Put a towel on top of the injured body part and place a bag filled with ice and water on top of the towel over the injured area. Keep the ice in place for up to 20 minutes. Phone 911 if there is a large open wound, the injured body part is abnormally bent, or you're not sure what to do. If it hurts, the person should avoid using the injured body part until checked by a healthcare provider.
Okay, we're getting low on time, so I'm going to briefly, Matt's going to do some splinting on me. When someone breaks their bone, splinting helps keep the arm or leg in one place, and that helps with the pain. Because when someone breaks a bone, the worst pain is the broken part rubbing against each other. Okay, so you always want to stabilize the break. And why don't we do I broke my arm, Matt, and yeah. We'll do that.
All right, so the theory behind splinting is you take that broken bone, you want to give it some kind of support. So if his arm is broken here, it's just going to be loose, move. You want to immobilize it with something like this.
This is what we use on the ambulance, but at home, a magazine rolled up can hold it. Something, a pillow. Just you want to keep it so the person's not in pain.
So what you want to do is first put that board or that stick or that magazine against the bone.
Yeah, I got it.
Then you want to take whatever you have and secure it. So we're going to say the brake's here. You never want to put the anything on top of the brake. You want to go above and below. So we're going to just secure it.
This be on a compound or not?
Both.
Be sticking out.
No. It could be. You do this on both, especially compound. You want to stabilize it. They'll be able to tell you, and you'll see swelling. You'll see swelling.
There'll be a large bump or some kind of bruise right in that area where the break is. Or the person might be complaining, oh, it hurts
Right
here
there,
on the arm.
yeah. So
So if you look at this, now it's secure, it's not gonna be moving around. He can bounce around a little bit and it's gonna hurt just because it's an injury, but it's not gonna really hurt since it's secured down.
we can, want to throw one on?
Let me do this, I gotta steal one. There's different kinds of products you can use too.
You know, duct tape. Duct tape works great. Like a magazine and duct tape, you can make a splint.
So what you do is you have them, if they can, don't force them. If this is comfortable and it hurts too much to bring that arm in or that injured extremity in, just leave it where it is. But if you can, get them to kind of give themselves a little hug. And you want to make a sling just to take the weight of that arm off.
This will really makes the person feel it's comfortable.
So this is loose just for demonstration purposes. What this does is now the patient can relax the arm in the sling and it's going to support it. So they don't have to use any muscles, put any of their own weight on it. This takes all the weight off. Just make sure this sling is not on top of that wound. If you put it on top of the wound, it's going to cause them pain, obviously.
And I know this is, we're EMTs, so when in doubt, someone with a broken bone, call 911, okay? But if, you want to make them comfortable, you can, especially an arm, magazine and duct tape work great. Except probably no one gets magazines anymore in this digital era. Yeah. So, questions, because we're getting low on time here. Yes. No, go ahead, you can.
So if we're going to can we just go to the ER?
If you feel comfortable driving.
But not doing this, just go to the ER, or should we do that?
If they're comfortable like this, and you want to drive them, just go like that. But when in doubt, call 911, we'll bring them in the ambulance. Question?
If someone has like a broken bone, do you still make a donut bandage, or say like they have a knife, do you put something around to make a donut?
If the bone was sticking out, I would pack stuff. Well, you wouldn't really. I'd put like a towel, dishcloth over the bone sticking out, just to we'll stabilize it when we get there better. So, yes.
If you call 911,
Yes.
what vehicles come here?
What vehicles? Okay, in Wellesley. In Wellesley, the fire department runs the emergency medical service, okay? Every firefighter is an EMT, which means we're licensed to work in ambulance. We also contract out to Cataldo Ambulance to have a dedicated two paramedics. They're not firefighters. They're just paramedics with the ambulance and the firehouse. They're a higher level than us EMTs. They can do more of giving certain drugs, doing airway management by intubating people and so on. But we work hand in hand with them. So you get a fire truck with EMTs on it with the ambulance, and the police always send the police car that's in that sector will go. Because some of the police officers are EMT, but they're all trained as first responders, which is basically a first aid course on steroids. So, and I know that you're asking, why do you send a fire truck on an ambulance call? Well, it isn't like on TV. Sometimes we need tools on that fire truck. A lot of times people are on second or third floors. We need the manpower. And we have to stay with the fire truck, so when our call's over, in case a fire comes up or anything else, we call the fire truck it's not just to put out fires, it's a rolling toolbox. We have tools that can do everything, okay? We've had to break into houses, and so on, and things like that. And manpower, lifting heavy people down flights of stairs and so on. So, yes, sir. Yes, she asked, do we have reciprocal agreements with towns? There is the big, across the state of Massachusetts, a whole mutual aid agreement. And we're broken into 16 districts. We're District 13, so we have 27 cities and towns that we're in a mutual aid agreement with. So when our ambulance is tied up, we call, Needham, Natick, Weston, Newton, and they'll send one. And just like our ambulances go to their towns, our fire trucks go to their towns, they come to our towns. It's a whole statewide network. Yep. So, yes, question in the back. If you're down 911 and don't know where you are, they're going to ask, look around. Do you see any landmarks? Do you see a sign? Something that, we've had that people out in the woods, especially, where we have trouble? The pathway around Lake Waban. Yeah, because they can't show where, no, the cell phone works, it's where are you? That's a long path, and you wouldn't believe how many times people twist their ankle. And we think you're on the pond road side or you're on the wells, and yeah, that path around Lake Waban. So do the best you can. What do you see? And dispatchers are trained. They're trained to get things out of you. So, yeah, landmarks help. I mean, we just got called the other day, supposedly a big accident on 128. So we went there and found nothing. Turned out it was in Newton because people get mixed up where they are and so on. Yeah. I told them how it works with the state police to make sure I'm in the town of Wellesley and so on. Yeah. And let me touch base on those medical alerts. I highly recommend them, especially for people that live alone. And what it is, you've seen the ads, help, I've fallen and I can't get up. We go to a lot of medical alerts. And if you live alone, you can arrange through the medical alert company to have a little, it's called like a little safe box put on your house that the the company will give to us the code, and then we'll have a key in that little box. Because, on the fire truck, we have a master key. It's called an axe. But does a lot of damage, and people frown when we use that. But you can place a key, or you can have it so a lot of people have a key hidden. Then the alarm company will know where the key is. So I'll tell you that with my dad, though, when my mom died, I set him up with the emergency alert. There were two types, the wristwatch type and the pendulum, I guess, goes around your neck. So he, being a guy, he wanted the wristwatch one. But what happened when he had his massive stroke, he had it on his good side, but his paralyzed side, he couldn't go over to do it. Now, I hear, that was 3 years ago, I hear now there's new ones out there that detect a fall, and they've gone, but I would have never thought of that. And he couldn't get it to do it because he was paralyzed and it was on this arm. So, but they do work, and highly recommend, especially if you live alone. We get called, we'll get called out, and they're great, especially fallen. Part of my job as a fire educator is working with the seniors, and I've been on calls where people have been on the floor a long time, and do that, and so on. I think they work, and I just Google. There's a bunch of companies out there. My dad had the one out of Framingham, Phillips, I think it was. But they're very good, and now I believe they'll detect fall. So yes.
I was going to say my mother has Phillips.
Yeah.
An elder care person recommended it because they're local. They have a local provider. A lot of the other companies, we had one before. It's like in Nevada.
Right. Phillips is out of Framingham. And is that Life Alert or Lifeline? I think that they line.
They have medallions now where if you start to fall,
Yeah. Yes, see, that's what they've gotten better on. So, like what happened to my dad wouldn't happen again, because and I'm trained. I didn't see that coming at all, you know. So, yes, questions as we. No, it goes. You need a dedicated phone line. You need a hard phone line. I think I don't know now. Back when my dad got it in 2012, you needed a dedicated phone line. I'll bet you they must have something now with cell phones. That's a question they would have. I bet you they have something. Yeah. So, I know this was. See, technically, this is a 4-hour certification course, and you'd have to. That's why they have breaks, and we have to teach it. It'd be just too much to do. So I just wanted to give you an overview of basic first aid. I can be reached, if you want to reach me, Ashley and Cheryl, Health and COA, they have my email address. I'll be happy to answer any questions. I will hang around afterwards to answer any questions you want. But yes, Cheryl.
Please don't leave without.
Goodie bag. I guess there's goodie bags. Don't leave. So, thank you very much.
For a child? Yeah.